I'm a UNCG alum. Even came back. I did the master's to PhD program in ERM, and then a few years later came back and got my MBA from the Bryan School too. Just couldn't stay away. Nothing but good things to say about UNCG. I think the ERM program is the best in the country. And so kudos to everyone on the call, both the faculty and the students who are there, because it takes both sides, to make it a good program and everything. And so just really major kudos to you all and the continued great work that you do. I sing y'all's praises every chance I get, and it's easy to do. And people are always happy when they get the chance to work with a UNCG person. So again, thank you for the introduction, Henry. As you said, I'm at the PA Education Association. We are a membership organization for PA programs. So PA here meaning physician assistant or physician associate. That title has been a little bit in flux over the last few years. So we actually made the calls organization just to go by PA. So we could cover everyone. Those PA programs are our members. So currently there's around 310 and growing programs. So this would be something like here in Atlanta at Emory University, there is a PA program, and so that PA program is our member. In the testing space, those programs administer our exams to a high degree. So we offer a few different exams through the PA Education Association. We offer what's called the PACRAT, which is our oldest exam. It's now been around for 30 years. And that's kind of how the assessment program got started. It is meant to be more formative self-assessment for students to kind of gauge where they're at and how their PA medical knowledge is going. But programs also use it in aggregate to kind of evaluate how their program's doing against national averages, things like that. We also have our end of rotation exams. And those are exams that a PA student will take at the end of a rotation, as you can expect. So most PA programs in their second year, that's a highly clinical year. A PA student will go and do a rotation in pediatrics. And then when they get back from that rotation, they'll take our pediatrics end of rotation exam. We have 7 of those in various areas: pediatrics, family medicine, internal medicine, emergency medicine, things like that. The kind of the core rotations that PA students do. And then our most recent exam that we launched at the great time of 2020, no better time to launch, a secure proctored exam than the onset of COVID. But that's when we launched the end of curriculum exam, which, as the name suggests, is meant to be taken at the end of curriculum. So it's kind of like a final exam that programs will administer for their students. Some interesting pieces about PAEA with our exam programs. We develop the exams. We use PA educators to write the items. We have some in-house psychometrics now, but that's kind of been growing over time. When I came to PAEA 4 years ago, I was their first in-house psychometrician. We still rely on psychometric vendors for a good bit, but we've been building that team. We now have Henry as our psychometric graduate student, and we also just brought on a full-time psychometrician back in the summer as well. So we're kind of expanding that. But we do kind of use a blended approach to where we do some stuff in-house. We then also use a vendor for some other pieces. We also, I'm going to talk about standard setting on this call, which is setting cut scores. We set cut scores or performance standards on one of our exams. That's the end of curriculum. And I'll get into that as a kind of a case study example after I lay some of the foundation for what standard setting is. It's important to note that with our exams, we kind of put them out, we provide scores, we provide interpretive guidance, but ultimately it's up to the programs to decide how they use them. And so while we will put out cut scores and things like that, and how the cut scores were calculated, how they were derived, all the work that went into them, the interpretive guidance, all those pieces, really it's up to a program whether or not they pass or fail a student. I bring that up because we're different than a certification and licensure organization to where they truly set a cut score that is a pass-fail decision. One of our sister organizations, kind of the 4 orgs that work with PAs, NCCPA, who Henry has also had experience with, they certify PAs. And so they set a true cut score to where if you don't pass that exam, you are not a certified physician assistant. And then it's not actually a license, but it operates as a de facto license to where you actually can't practice in most states. You can't get licensed in most states without the certificate. So that's probably a little bit too much information there, but I wanted to go and chat to get some context for the nature of our testing programs. Let me start sharing my screen. I don't have a bunch of slides. I would love it if something I said inspired a conversation. That's not the right screen. 1 second. Let me start sharing. I will say, please feel free to interrupt me at any time. And let me get my screens figured out real quick. See if this works. All right, can y'all see my screen? Cool, excellent. All right, so again, here to talk about standard setting today. Quick overview. This is kind of what I'm going to run through. Again, I would love it. If you have questions, feel free to interrupt me. That is not disruptive. No problem at all. But there will also be plenty of time for questions, discussion at the end. So if you need a little time to process, or if you're like, wait, I need to ask this at the end, that's totally fine as well. But anyway, we're going to talk about the kind of context, purpose, relevance of standard setting. I will be honest that I love standard setting. I am biased. I like it in terms of things we get to do in the psychometric world. In my opinion, it is the best balance of the psych and the metric side of psychometrics. So much of the other pieces we do are really one or the other, and this is where it forces you to really do both. And so that is my own personal bias. I will say I'm in the minority among psychometricians. Most psychometricians do not like standard setting. And so my hope is that I can inspire you to not hate it here today, and maybe one day you'll be off doing your own standard settings. We have some important concepts, just kind of foundational pieces that you need to have in mind as we're having the conversation. I'll talk about common standard setting methods. We won't get too in depth here, but just so you have an idea for what's going on. The implementation of a standard settings are often conducted as workshops or exercises. And so we'll talk about how it's actually implemented so you can have an idea for what it looks like out there in the real world. We'll talk about the example case. We just did standard setting on our end of curriculum exam, which Henry got to be a part of and actually contributed in a major way, which was excellent. And so I'll talk about kind of what we did there. And then again, time for questions, discussion at the end. My intention is not to talk for the next 47 minutes. So please, again, feel free. First of all, again, I also apologize for looking over here. This is where I see your faces over here, and this is where the slides are. So I'm gonna do my best to at least appear that I'm still looking at y'all, but anytime I need to see you, I'm gonna actually look over here. All right, so context, purpose, relevance. One of the things that we have to kind of get established from the start is that standard setting is a policy decision, but it is informed by psychometrics. And I bring this up because all the work that you will do psychometrically to get to a standard setting recommendation, to a cut score recommendation, in every case that I have ever known of, and it's well documented literature, at the end of the day, it goes before some policymaker to confirm, to modify that standard. And so just bring that up from the start to say, again, this is, again, where you get a pretty big blend in standard setting of psychometrics, some policy work, you do a lot of construct development, you do a lot of mathematical analyses and true traditional psychometric analyses, but at the end of the day, it is a policy decision. And so there's just that, I bring that up because you have to know that at the end of the day, what you're going to do is take this to an audience that is likely not going to be psychometrically savvy, so to speak. And so you kind of need to conduct the study in such a way and be prepared to communicate it in that way. And so just kind of getting that out on the front so you have a concept for that. Just the standard definition of standard setting here is the process of identifying points on a score scale that separate examinees into qualitative distinct performance groups. Said another way, you're identifying cut scores. You're trying to find the points on that score scale to where you can say, okay, these group of individuals have demonstrated this level of knowledge, and we can infer that they know and are able to do these things. And then these have demonstrated this amount, this level of knowledge. And so we can make these other inferences about them. That's the goal of standard setting. It is to get to a point to where you can say, okay, this is what this score means, and this is what this score means. That's another reason why I love standard setting, is because a lot of the work that we do in psychometrics, it ultimately doesn't get down to what a score means. And that is really what we're doing with standard setting. It has huge implications for validity, for the interpretation and use of a test score. I think really it's, when we go through the validity argument, you can do everything right. And if you set that standard wrong, then the rest of it is moot. So just bringing that up, again, getting on my soapbox a little bit. So I'd like to give this kind of visual representation. This is a copy of a slide that I actually used in my most recent standard setting to kind of help conceptually what we're trying to accomplish here. So there is this knowledge continuum out there in the world. For us, we're using PA medical knowledge. And we think that there are these kind of three distinct categories: this limited level of medical knowledge, a satisfactory level, and an advanced level of medical knowledge. Now, what we're trying to do in standard setting is identify kind of the points where we can tease those apart, and we're going to use the score scale to do that. So theoretically, there's this person out there with this limited level of knowledge, and we want that to correspond concretely to some point on the score scale. That's what we're doing in standard setting. We're mapping this theoretical concept, dealing with our construct, down to very concretely where on the score scale can we set that mark so that it actually separates people into these groups. And so for a lot of certification and licensure exams, you only have one cut score. You're trying to say, okay, who is competent, who is capable, those pieces to go out and practice, to teach, to practice medicine, whatever it may be, versus who's not. And that's usually geared towards, it has the orientation of public protection, right? You're trying to say, okay, this person has demonstrated the medical knowledge, so they are safe to practice, and the public will not be harmed by them out there practicing medicine. I have I have two cut scores here in three categories, because this is what we do for the end of curriculum exam. We actually have three levels. And again, the idea here is to help programs identify, okay, which students are falling in that limited category and either aren't ready to graduate or are going to need some extra work before they're ready to graduate. Satisfactory is our interpretation of, okay, they've demonstrated a satisfactory level of medical knowledge. And then advanced kind of helps them identify those students at the top who are kind of overachieving. Perhaps they have some kind of award that's tied to that, whatever it may be, kind of identifying those star performers. That's what we're trying to do with standard setting. This is an example slide because I also want to share kind of how I communicate this to subject matter experts, because in standard setting, you will work with subject matter experts. So again, kind of I've already covered a lot of this. In that first bullet point, I give them the purpose of standard setting. I also try to normalize it a little bit for them. Standard setting is a very hidden concept, I'd say, or not deliberately hidden, but people who even know about testing in the outside world, so not psychometricians, but people out in the world who know about testing, they often don't know about standard setting. When we conduct a standard setting workshop, this happened a lot at the ABP. It's also happened at PAEA, where they'll come in and they'll say, I had no idea that like this is how you got to these cut scores. They think someone just sets it. They think that something happens, right? But they have no idea that this is standard setting. This is what they're doing. So I try to normalize it a little bit for them and say, look, anytime that you say this is an A, this is a B, C, D, F, you are doing standard setting. Anytime you say this score means this, you are doing standard setting. Now, luckily, especially for large scale assessment, there are best practices grounded in the literature, ways to conduct standard setting so you can do it in the most rigorous scientific way possible. But I do try to normalize it for them and say, look, this isn't some totally foreign concept. You've actually been, especially when you're dealing with educators, you can say you've actually been doing standard setting most of your professional life in some form or fashion. And we're just trying to kind of normalize it for them and let them know that we're about to go through it in a very rigorous way. Some important concepts here. These are not all of the important concepts. There's many important concepts, but just a few. I want to kind of give some of the important pieces that you'll hear or talk about with standard setting. The first is performance level descriptors, achievement level descriptors, categorical performance descriptors, anything like that. This is where you're really setting out the KSAs and whichever version of that you want to use for what people know and are able to do in these different performance levels. I'd say in a good standard setting, you spend more time working on these performance level descriptors than you do anything else. I'll use, because it's a little bit cleaner and simpler, I'll use the example of certification licensure. When you hold a standard setting for a certification exam, you bring in your SMEs, and the first thing, well, one of the first two things you'll do, I'll say, is work on these performance level descriptors. That's where you'll bring people in and say, okay, for people who are qualified to practice, who know the medical knowledge they need to treat patients in a safe manner, what do they know? What can they do? What are the procedures they're really good at? What are the procedures they struggle with? And you'll kind of walk through it, and it's really kind of fleshing out what people know and are able to do at these different levels. So again, there's different terminology out there depending on the purpose of the exam. Performance level descriptors, PLDs, is a good kind of catch-all term there, but it can be called different things depending on the context. Again, it's super important. Henry can vouch that at the standard setting we just did, we spent more time on this task than we did anything else, because it is that important, and it really helps with standard setting, you're working with a group of SMEs. And so, and those are subject matter experts. And it helps to ground them in what you're doing and create that shared concept of the students or examinees that they're going to be thinking about kind of through the rest of the workshop. I have the role of judgment here. I think this is why most psychometricians hate standard setting, because pretty much any standard setting method requires judgment. And it's not going to be purely empirical, mathematical. There is judgment involved. Even if you have the least judgment possible standard setting workshop, at the end of the day, the policymakers are still going to pass a judgment on whether or not that's the correct standard for the purpose of the exam. You can go back to 1978, great article by Glass, who said standard setting is arbitrary, but it's not capricious. And that's an important distinction here. It is arbitrary because a cut score could be 68, could be 69, could be 78, could be any of those numbers. However, it's not set in a capricious way. It's not set without thought, without intention. And so it's important to acknowledge the fact that, yes, judgment does come into this process, but we do it in as rigorous a way as possible to ensure that when we get to that end number, it's done right. It's done with the most information possible. Minimally qualified, minimally competent, borderline, these are all terms you'll hear, particularly with the, with both the exam-centered methods we'll talk about and the examinee-centered methods we'll talk about here in a minute. And really that's when you go through the performance level descriptor exercises and you've kind of really documented everything of what people can know and are able to do. A lot of times you will then ask the SMEs, okay, but what about those just barely people? What about those people who are just passing the exam, who are just inside the satisfactory or advanced medical knowledge categories? This can be much of this can be uncomfortable for SMEs. This can be a very uncomfortable conversation for SMEs, particularly for high achieving folks who like refuse to think about minimally competent or minimally qualified. We face this a lot. I'll give an example with medical doctors who have spent their entire life achieving very highly and doing very well. And the idea that anyone is like minimally anything is not a very comfortable feeling for them. And so I bring that up to say, again, if you're doing a standard setting, you're going to be working with these SMEs, finding the right language to use so that they don't get hung up on that and can focus on the important piece, which is, look, we're looking for people who just passed. That's really what we're talking about here. And you're kind of getting them to acknowledge the fact that there are superstars and there are people who kind of just make it. And we need to be able to focus on those people who just make it in a lot of these methods. I just have the word iteration on here because every standard setting method I have ever seen or been a part of is iterative. Very rarely will you do one round of anything and that's it in standard setting. Often, and I'll get more into this in the methods here in a minute, but you'll have the panelists go through, do a round. You'll then provide them with feedback data. You'll have discussion. You'll talk about the process, talk about the results, and then you'll do another round and potentially another round as you try to really refine their thinking. One thing that I often, and this is not, I'll say this is not standard across all standard settings and psychometricians, but one thing that I will reiterate to them in this iterative process is that the goal here is not to get them all to the same exact point. We have recruited a panel. We have recruited as large a panel as we're able to do this exercise, and they will bring different perspectives. What I really want to do through this iterative process is help them refine their own concept, and in that they should be building a shared conception. Yeah, Devos, go ahead.
You mentioned the issue with having highly qualified, experienced SMEs on your panel. So, do you ever consider maybe having, I don't know, how does that work in practice? Do you get people who have minimal experience, a certain degree of minimal experience, not necessarily like the stars in the field?
Yes, that's a great point. Yeah, so when you are recruiting panelists for standard setting, for one, it's important to get a nice representative sample as best you can because standard setting panels are never that big. And so you're basically doing the best job you can with like 15, maybe 30 people if you're lucky, because most organizations honestly won't pay for a standard setting that goes any larger than that, if I'm being totally honest. It also gets kind of unwieldy to manage any larger than that. So you're trying to get the best representative group you can at a pretty small sample, but in that you're not looking, in that I'd say you should be looking across different areas that you care about. For example, with the most recent EOC standard setting, we wanted a couple program directors, we wanted a couple faculty, we wanted some newer faculty, some experienced faculty. We tried to look across those areas. I said that when I've done certification exams, we will look for people who kind of span the continuum, people who aren't all the people who aced the certification exam. You know, people who are going to bring that perspective of, look, everyone doesn't get 100 on every exam. Like that's not how measurement works. You know, we'd be doing a bad job if they did. So it's a great point, Dedos. I think that that's the intent. You try to get a nice diverse panel that maybe isn't all superstars. At the same time, sometimes you just still deal with it, you know, because again, sometimes these are folks who even the just barely folks are, you know, high achieving, and like no one wants to be called minimally anything. And so that is the case to where borderline can kind of help. A word like just barely passing, things like that, a phrase like that can be helpful. But it's a great point, particularly in recruitment, because you are going to be dealing with a small sample here. And so if you get 12 people and all 12 of those are people who have just absolutely aced the exam on their last time through, I'm willing to bet you're going to get too rigorous of a standard coming out, because they're going to have too high of expectations for how people are able to perform on the exam. That's a great question. Any other questions kind of what's been shared so far? Okay. I have normative data here in just a second. I'll talk about the difference between norm reference standards and criterion reference standards. But really the issue or the concept of normative data comes in both of them. When we get to our criterion reference methods, the intent there is for the judgments, the recommendations that are made by the SMEs to be based on those performance level descriptors and what they're seeing in test content. And we kind of ask them to like disentangle their judgment from the outside world and from thinking about really the implications of what they're doing. You know, try not to think about how many will pass and fail. We really want you to focus on, you know, what's the right cut score based on the knowledge, skills, and abilities. Now, having said that, pretty much every standard setting method at this point in time brings in normative data at some point, because you have to anchor people back to the real world. What will happen a lot of the times is you'll do round one of some standard setting, and that standard, more times than not, is like really high. And you have to share with them, okay, if we set that, so the historical pass rate for this exam has been 80%. If we set the cut score there, we'll have a pass rate of 40%. You know, like you have to kind of rein them in a little bit and say, okay, let's kind of root this back a little bit in the real world. There's also some known as compromise methods, which are widely used. The Hofstede method is a really popular one. I'll show you some examples of that here in a minute, to where it tries to blend these two pieces of information. It tries to blend, okay, what should the cut score be based on a very criterion reference mentality, but also what would you expect the pass rate to be? And then you kind of blend those two pieces of information together. So normative data and when to include it is a line of research, honestly, in standard setting. And where the consensus is now is that you should include it. However, when and where is really important. So a quick overview just of standard setting methods. We're not going to get too in depth here on the specifics of the methods. I'm happy if anyone wants to talk about any of these, shoot me an email or find a time to talk. Happy to go through it. Very quickly, first, though, kind of separating out norm reference versus criterion reference standards. A lot of times when we talk about standard setting methods, we immediately start thinking of criterion referenced standards. We start talking about, okay, how are we going to set this cut score such that it separates out these folks in knowledge, skills, and abilities? But there is, of course, norm reference standards to where you can say, okay, you can set it as 80, we want an 80% pass rate. That's what the standard is going to be here. So then what is the correlating, the corollary cut score that will get us there? So there are norm reference standards as well. A lot of what we do, though, does focus around criterion reference standards. So within those, there's kind of the test or exam centered methods. I have the two most popular here, Angoff and Bookmark. Angoff has been around since 1971, came out of a paragraph and a footnote in the Ed Measurement text back in 1971. It's a real cool story because there have been like a proliferation of Angoff methods that have come out of this, all out of a paragraph and footnote. And in fact, Angoff even says in the paragraph and footnote that it wasn't his idea. And so yet everyone knows the Angoff method now for the last however many decades that's been. one quick aside here, just because I find it interesting, and so it's kind of in sociology, I guess, but there's Stigler's law of eponymy, which basically says that any scientific thing that is named after someone, that's not the person who actually discovered it or created it, and this is a case of that. So anyway, that's just interesting, and when you're looking for your next other read, you can go look up Stigler's law of eponymy. With each of these methods, with a test exam and exam center methods, really what you're looking at is you're asking SMEs to look at test content and to make their judgments based on that. So with the Angoff method, there's the yes/no Angoff method where you'll ask SMEs to go item by item through an exam form or sample form you've created and say, will the minimally qualified, minimally competent, borderline person get this question right? And they're just kind of going yes, no all along the way. Then you aggregate across to get your cut score. There's also what's known as the modified Angoff, which is more widely used. And now no one actually uses the Angoff method. If you're using the Angoff method, you're actually doing some modification of it because again, it's not actually the one that was given in the paragraph and footnote. The modified Angoff, as it's commonly referred to, actually asks participants to go through and say what percentage of minimally qualified or borderline candidates would get this item right. So they'll go through and say item one, pretty tough item. Only 40% are going to get this right. Item two, pretty easy item. 90% will get this right. And then again, you just aggregate across to get your cut score on that set of items. The bookmark really gained prominence with No Child Left Behind as states were required to report on these different achievement levels. And so what happened with that is states were given exams where they had multiple cut scores. The Angoff is a very onerous process with multiple cut scores. You would basically have to ask a participant to go through the entire set of items and do it for the minimal, level. Do it again for satisfactory. Do it again, whatever the levels are, 1, 2, 3, 4, whatever they are for all the levels. So it's very onerous. The bookmark kind of sidesteps this problem and it puts the items ordered by difficulty. You have this ordered item booklet. It's commonly referred to, obviously no one uses booklets anymore. It's all done on the computer, but it's the ordered item booklet. It's the items in order of difficulty going from easiest to most difficult. And so people will go through and they'll say, okay, for like the minimal person, they're still getting these items right. Oh, this is where they stop getting the items right. So you'll put your bookmark there. Then you'll say, okay, for like the satisfactory, they're getting these items right. Okay, here's the cut. Here's where now they're not getting these right anymore. We're moving into the next category. So it kind of streamlines the process. Some of the early literature talked about how much easier this was than the Angoff from a cognitive load standpoint. I tend to disagree with that because people are still making the same decision. The bookmark really is a yes/no in an ordered item booklet. And so I tend to think that you are saving time, it is more efficient, and you are asking people to go through the book fewer times, but I don't think the actual cognitive task of evaluating an item is any less difficult than the yes/no Angoff. My 2 cents there. Then we have the examinee-centered methods. These are, to be honest, these are less common in kind of large scale testing in my experience, but they are very valuable methods. And it kind of goes back to the purpose and the nature of the exam. If you're doing things with portfolios and things like that, these are really good methods to use. My experience has just been much more with large scale, honestly, multiple choice questions, things like that, which the test centered approaches are really well geared for. One method that I would love to see more of that large scale even multiple choice questions could use is the contrasting groups. That's where you're basically looking at 2 different groups and looking at where their distribution kind of meets to set that cut score. This is something that could absolutely be done with many certification exams, things like that, but it's not often done. So that's one. Body of work is where you are kind of combining portfolios of students' work and then allocating them to the different groups. And that's how you're setting your cut scores there. Again, I'll be honest, I have less experience with these, but there is plenty of literature out there. Unfortunately, the standard setting text is getting a little bit old now. 2012 was when Cizik's last text came out, but there is a good description of these methods in there. Yeah, Dead DOS. Oh, you're muted, Dead DOS.
I think listening to what you're saying, I think it all depends on, it also depends on how big this your sample or you're working with, all right?
Yep.
So if you don't have that large groups of people, then the contrasting groups may be something that may not be very amenable, I believe.
Totally. Yeah. Yep. Nope. You're absolutely right. And I think that, so that's one piece of it. I think the other piece and why I think more groups haven't. So let's take the example of certification licensure. What you would need with that is you would need a sample that you essentially like know are not qualified. They are not
Hmm.
qualified to practice medicine, and you would need to have a known group that is qualified to practice medicine. Getting that group that you know like are not qualified to practice medicine is a hard group to identify, right?
Hmm.
With standard setting, we really face the issue to where once they're certified, once we set that cut score and they're certified, we've just lopped off, an entire part of the distribution. And so it can be really hard to identify those groups.
Hmm.
One thing that I'm trying to work with some of our PA programs now is I would like to give the end of curriculum exam to students like their first day in the program. And I'd like to use that to kind of set up a distribution of, okay, these are students who should not know
Hmm.
medicine. And then let's compare that against the distribution of students at the end of their program and look at it that way. But again, it's not really widely done. And I think it's a shame because I think there are opportunities there. But to your point, both the size of the sample and just the availability of a
Hmm.
population to sample can be really difficult with those. Yep. And then
Thank you.
just kind of this last, yeah, absolutely. Just kind of this last bullet point. This is another one that I think is underutilized at this point. And generally I'm calling it the externally focused methods, but this is really where you're using other data and not judgment to get to standards. It's grown a little bit. There's been some recent publications, I say recent, last like 7 or 8 years, so maybe not so recent. But this is growing, especially with some of the K-12 assessments to where they're pulling different pieces of data together and really triangulating to say, okay, based on all this other information we have and what we know about our students, what should the cut score be on these various exams? Implementation, I'll go through this kind of quick. There's a lot here. So this is another place where I'll say if you have questions or if you're involved in a standard setting down the road and want to talk it through, shoot me an email. You got to start with your method selection because that's going to really govern the rest of what you do. So we talked about methods on the last slide. So anyway, you need to select your method first because that's going to determine how do you set up the item bank pool or form of items that you're having people look for, or in something like a body of work method, which samples of work you're going to pull to kind of create the materials that the panel will look through. Panel recruitment, this is something that DevDOS was getting to earlier. That's when you actually recruit your panel of SMEs to come in, be a part of it. You're really doing the best you can to get all of the perspectives that you want in the room. You're not going to reach any kind of saturation with sampling for this panel. So you really just have to do the best job you can to get every perspective that you want to come in. You need to get it in the room. Logistics and technology. This is a meeting. They've been done virtually now, thanks to modern video technology and everything like that. But a lot of standard settings are still held in person. A panel is recruited. You fly them in somewhere. You're in a room for 2.5 to 3 days doing this work. So there's just all the logistics with it. Henry can also attest to the fact that thank goodness we have a great team here at PAEA who handled all of that. And so I got to focus on the other pieces, but those are non-trivial pieces of the meeting. It's also, you're inviting SMEs there to give their perspective. You want them to be like in a comfortable headspace there too. And so some of these things that you think don't really matter, as much, the food, different things like that, they do because you want people to be able to focus on the task they're there for. So just some points there. Technology too, for the standard setting we just did, Henry built an app in Shiny to collect data, which is excellent. If you have that capability, it's a great way to do it. So you can kind of set it up exactly how you want it for people to provide your ratings or however you're collecting data. Absent of that, you can use survey software often to collect it. Some item banking software now has the capability to do standard setting within it, but you need to think about how you're going to collect your data so that you can then analyze it. I alluded before to the iterative nature of standard setting. You need to have a quick way, usually, to analyze the data. And so thankfully, with all the things that we can do now with computers, it's not what it used to be, which is people actually writing it on a hand, do you then put it in somewhere, things like that. Having some way for the panelists to enter their ratings, however they're making their judgments, that you can then analyze quickly is really important. The analysis and validation piece. So again, this is iterative. You're probably going to run the analysis multiple times throughout the study itself while you're actually conducting the study, but then you'll do a final analysis at the end. Also, the validation piece. Much of the validity of standard setting literature out there, and what is done most prevalently in practice really focuses honestly around like the procedural and operational pieces of standard setting. It's, did the panelists understand the task? Was there enough time for discussion? Things like that. What's really missing in a lot of standard setting studies is that final piece, which, okay, was it actually set at the right spot? You know, like is where we set the cut score actually a meaningful place to differentiate test takers. So that's like a major piece that's missing a lot of times. Honestly, the reason it's missing in a lot of cases is because it's the hardest part. Going back to certification and licensure, and I'll give PAs as an example. PAs, once they're certified, you have them out there practicing, and maybe you could collect data on the people you have certified, medical outcomes, things like that. You don't have data on the people who weren't certified because they're not out there practicing medicine. So you can't really compare, okay, you know, is this group demonstrably better than the other group? And so I'll say, unfortunately, because of its difficulty, this is often not done, and it's just a major gap in standard setting. And standard setting overall and its place in psychometrics will be improved if we can get better about doing that. Because again, it is like the most important piece, but it's the least often done. All right. And then the final decision on standards. So then once you've done all of this work, you then take it to the board, to some policy making body who's ultimately going to say, okay, you've convinced us that you did this the right way, that the people knew what they were doing, and that this is where the cut score should be, and then they officially set the cut score. All right, I'm going to jump into an example here. Some of these slides are slides I pulled directly from the presentation I gave to the board with this standard setting. Some of it has been redacted, so apologies for that, but we haven't published the standards yet, so I can't be on here talking about what the new standards will be. They have been approved, so that's fantastic. The board was convinced that we knew what we were doing, and they agreed that the panel set it at the right spot, so that's good news. But again, it hasn't gone public yet, so you'll see I have some things pulled out here. Some quick background on the exam we're talking about. We're talking about the end of curriculum. Again, that's the exam that students take when they finish their PA program. It's 300 questions, 250 of those are scored, and we have multiple forms going at a given time. So why did we do the standard setting? This is an important piece. So in a typical situation, standards will be set initially to pass, fail students, whatever it may be, but then you'll do equating from there on out. You'll basically set the standard, and then you will do some form of equating to maintain it over time for all the important reasons, for equity, everything like that. You will just do equating from then on until you need to reset it. There is some guidance out there in terms of when to reset the standard. Honestly, you should probably revisit a standard every 5 to 7 years, whether these reasons come up or not, because things change, and things may be changing that you're unaware of. Now, things that you can be aware of are changes to the examinee population. This is the case to where maybe, for using the example of PAs, maybe curriculum has changed, maybe certain requirements for admissions have changed, and you're getting different data, and so it's important then to say, okay, do these standards still make sense? And are they still leading us to the right conclusions and inferences on the back end? Then there's also changes to the exam content. And this is actually what triggered our standard setting, which is that we had modifications to the end of curriculum blueprint. It wasn't a wholesale change. It's honestly very similar to the previous one, but there was enough of a change and enough time had passed where it's time for us to revisit these standards. Something else that changed the first time we set standards on the end of curriculum exam, as I said, it launched during COVID. And so a lot of the data we had is probably going to be at least somewhat different than the data we're getting now from students. Student populations were different. The modes of education and curriculum were different and everything like that. And so really we kind of hit both of these criteria, and it's why we need to reset the standard now. This is just a slide. This is what we shared. I've gone into a lot of this already. Ultimately, we had 31 folks we brought in. I'll be honest, that is the largest group I've been able to convene to devote to a single exam. I have had bigger groups than that before, but they were doing multiple different exams. So we had 50 people in, but they were doing 4 different exams, so about 12 people per. This is the most I've ever been able to get. And again, it gets down to logistical constraints, budget constraints often. American Board of Family Medicine several years ago moved to a different model to where they did it asynchronously and had a group of about 100 folks providing ratings. So they got a much larger sample there. I will tell you that when you start doing things asynchronously, particularly with standard setting or when you're sharing exam content, you have to be very careful about security then. Whether you're like mailing them books or giving them access to your system, you have to really vet the people who will be involved, and you have to make them sign their life away that they are not going to give out that exam content. Most often you're doing standard say on exam content that either is live or will be live at some point. And so you just have to be really careful with that. This is basically how we ran them through the process. So first we brought everyone in and we call it the exam experience because that sounds better than we made them take the exam. You can imagine how happy all these PA educators were on the morning of day one. We're like, okay, now you're going to sit down and take the exam. You try to make it as fun for them as possible, whatever. But really the purpose here is for them to get an idea of the test content. I don't want the first time they see an item to be when they're making their judgments on that item. I want them to already have seen the item. I want them to have thought about it from a test taking perspective. What did they have to do to answer this question in their minds to go through and actually answer the question? Performance level descriptors. Then we spent a lot of time talking about performance level descriptors. With medical exams in general, I'll say those are typically pretty broad exams, especially when it's something like general pediatrics or an end of curriculum for PAs. They're covering essentially all of medicine. And so this is really important to kind of give plenty of time for people to drill down. Okay, what does satisfactory mean for cardiovascular diseases when you're doing a diagnosis versus when you're doing history and physical, things like that. So we spent a lot of time digging in and kind of teasing these pieces apart. We then use the bookmark method. Again, we have 2 cut scores, and so the bookmark method really kind of streamlined things there for us and allow people to kind of progress through the items and say, here's the cut and here's the other cut. It was an iterative process too. We did multiple rounds of the bookmark, and at the end we did a compromise method. It's known as the Hofstee method. The Hofstee method is super popular, particularly with the Angoff method. A lot of people do an Angoff method and then a Hofstee method, kind of piggybacking on it. We did a bookmark and then the Hofstee. With the Hofstee, I'm not going to go into too much detail on it because I've already been talking for too long and I want to leave time for questions. But essentially what you're asking them is, okay, you've done all this criterion reference work. Where should give me a low spot and a high spot for that criterion reference cut score, but then also tell me what's like the lowest fail rate you would expect and the highest fail rate, or flip it with pass rate. And you're really kind of creating a box, and I'll show you what that looks like here in a second. We did collect the procedural validity. I did my best to and I'm glad that Dr. Sloop DeVille is here because I definitely called it out. This is procedural validity. I'm not trying to say that this is enough to establish the validity of these cut scores. But these are essentially the statements that we asked the participants to rate. I pulled out the data here. I can tell you that Henry and I did an excellent job. Everyone understood everything, and they fully endorsed the process. So then here's where I'll start kind of showing the results to the board. I'll say, okay, and again, apologies, but I redacted some information here, but I'll show them, okay, these are the 2 cut scores that came out, and this is the impact of it. We talk about impact data a lot. When we talk about impact data, it's the pass rate. And so we'll say, okay, here's what the resulting score ranges would be, and here's how many students would fall into each of those categories if we were to adopt these. Also show them the Hofstee method, and I left the bookmark method on here. You can see these kind of boxes. Again, I won't get into the method. I really like the Hofstee method, honestly. It's not sufficient in itself, but it is a great tack on to the other methods because it really does bring in some of that real world stuff. And in my opinion, it's not sufficient. However, it is a really good add-on and adds some more information. So show them this information. And here, I just want to give some general guidance. So after that, the board discussed, we had a conversation, and ultimately they approved the standards. Just a couple general pieces of guidance that I'll throw out really quick. If you have the opportunity, sit in on a standard setting, just be a fly on the wall. It is really hard to get a concept for this or to really understand what's happening concretely just based on talking about it. I will say that if we have another one coming up, I'd be more than happy to have observers in the room just kind of seeing what's going on. It's really hard to get exposure to this in grad school because standard settings aren't super frequent. They don't happen all that often. And organizations aren't always super willing to have a student in the room when they're doing something like set the cut score of their exam. I can tell you that I love having students in the room because, again, it is such a rare opportunity. And so anyway, if you are working with the organizations coming up and they do have a standard setting, try to find a way just to be there, just to observe. If you can contribute, then fantastic. But even if you can't, just to be there and observe. Also, think about some next steps here. The standard setting is evolving for sure. But a lot of the methods that we use are 40, 50 years old. And so I would say think about those next steps, particularly with all the innovation and AI and everything else, things that we can do to make this process better, to make it either more rigorous or to start to get at really that most important piece again with that validity aspect at the end. Is this cut score actually set in the right spot in such a way that we can interpret and use this score in the way that we want? Again, that's a major piece that's lacking throughout standard setting. And so I would love it if someone on this call were to come up with better solutions there and to actually change this. So apologies, I talked for longer than I expected or wanted to. Did not leave a ton of time, but thank you so much for your time and would be happy to answer any questions, anything that has piqued your interest.
Thank you so much, sir. Questions from anyone? Please go ahead.
Robbie, as always, it's just delightful to hear you think out loud. You've always been a deep thinker and somebody who is able to cross different areas, different expertise to bring the measurement, to bring the know-how of something like policy and standard setting. You do that beautifully. Back in the early 90s, I did standard setting using modified Angoff, and I wish I knew about the Hofstee back then. So, but what was interesting, and that's related to the question I'll be asking, is I had, I did not expect to set the same cutoff scores on a test for three distinct groups. So these were three different language groups for three different tests, language tests, and we were using language descriptors. So those were provided, but the language descriptors varied from language to language, but they had the same spirit. So there was no expectation that the cutoff scores that would come out would be the same across, but it was fascinating that given the spirit of the performance level descriptors, that they were exactly the same. And the standard setting sessions were done independently, right, with different subject matter experts. So I was wondering if you saw it as a way of validation in your case to formulate subgroups, right, and think about would this type of background versus that type of backgrounds in subject matter experts, I don't know if you're going to vary it by content or by also years of experience, and see what cutoff scores might emerge as a result. I don't know if this makes sense. Or
No, it does make sense. And so I'll give one example. With this most recent one, we had 31 folks. And so we did divide them into two groups, but really the focus there was on replicability more so than like triangulation. And and it's because, and especially in the standard setting literature and just in our common minds, it's like, oh, the facilitator mattered. Like there's an assumption that the facilitator matters. And I think they often do. And so I think that what I've seen most common with multiple groups is really they're trying to say, didn't matter who the facilitator was, they got to the same spot, and they're looking for consistency kind of in that. I think it would be more valuable to have the two different groups like use different methods, like one to use the Angoff and one to use the bookmark, and say, okay, we still came to the same, or we didn't come to the same spot, and why is that, and try to figure out what it is. It's for us, we just split into two groups, but it was more about the size of the groups and trying to get to the same and making sure the facilitator didn't make a difference. But I think it's fascinating that y'all did come to the same spot.
I work now, I'm on the board of WIDA, and this is a test that's given to over 1 million students around the country. And CISIC is also a fellow board member. And so they've been doing standard setting, and it's just been a lot that's been produced in terms of how different rooms interact with the facilitator, the setting, the chairs, all of that stuff that you call procedural. So yes, it's fascinating. But if I may then, given what you just said, maybe this is a topic for a dissertation. We have graduate students here, and they can vary the method, they can vary the group, they can vary the duration. And so this could be a dissertation topic for those who are interested in the measurement psychometrics, but also the policy aspects of testing. So
absolutely, absolutely. And I'll just put a plug in there. If someone is interested in that and they need someone to be on their committee, I would be happy to be a part of that. So I'll go ahead and throw that out. And I think there have been a small number of studies published that actually look at comparing methods on the same set of items. One of the reasons why there are so few is because standard setting is such an applied process. It's okay. And this is another plug I'll say, if you're working with a testing group, please have them start thinking about cut scores and the standards at the onset of test development. Standard setting is by and large treated as an afterthought. We've done all this work, developed all these items, followed all these, and it's like, oh, and what's the cut score? Like you get to the end, it's for a certification and licensure exam, it's the main purpose of the exam. The purpose of the exam is to separate out these groups, and they don't think about it till the end. And so that's just one plug. But it goes back to, it's such an applied process that rarely are groups willing, to convene multiple panels and things like that. But it's not undoable. And I think that it would really contribute to the theoretical backbone of standard setting. Yeah, Michelle.
I'm wondering, and I'll relinquish the floor after that. I'm wondering if because of AI, we can simulate backgrounds and thinking. So I was wondering if it can be a simulation even.
I think that would be awesome. That's one of the things. So Henry's doing some AI stuff with us, and like we just keep coming up with like new questions. Not for his dissertation, of course, because that has to get done, and we won't add any new questions for that. But I totally agree. I think the level at which we can simulate has totally changed. I'm in full agreement.
Yeah. Thank you, Robbie.
Yeah, thank you, Stephanie.
Hello, it is very nice to meet you, and thank you for your presentation. I have two questions about the procedure. I have been a facilitator, and I have seen how judges struggle with the descriptor for the lowest level, or to describe the borderline student. They tend to include negative words in the description, and from what I have learned, we shouldn't do that, or we should avoid including negative descriptions. How was your experience with that?
Yeah, it's a great point. Thank you for bringing that, because it is a huge challenge, especially for us when we're dealing with three groups. Like one of the groups at the ends winds up being, oh, everything else, right? It's like, oh, well, they can do this. Like you kind of either work your way up or you work your way down, and it becomes, oh, the limited group is the group that can't do any of what the satisfactory and advanced can do, or going the other direction, it's like anything above. And that's not really helpful when you're looking through test content and everything like that. When we did it, we really focused, particularly because this was based on PA curriculum with the limited group. We kind of said, okay, like this is something that every student, even the ones who like don't quite get it, who aren't going to do this, like that's what they get right. It's okay. And we kind of had to start thinking. We had to kind of introduce the bookmark concept like a little earlier than I would have usually, because we had to start to get them to think in that kind of ascending direction of say, okay, so like we're talking about kind of, trying to avoid all the negative words possible, like that kind of bottom student, who's not your high achiever, who's far from your high achiever, and like, what are they still going to be able to do? Like, what can they get? But I will just say, I can totally relate. Even then, it was still a challenge, and you really have to keep them kind of working their way up. In terms of the minimally qualified, minimally competent borderline, every standard setting I have been a part of, by some time in the meeting, they start talking about, well, the average candidate's going to get that right. The average candidate, most candidates, and you're like, okay, but we're not talking about the average. You have to like really rein them back in, right? And say, we're not talking about the average candidate. We're talking about that person who's just getting there. Like, are they going to get that right? Or using the modified Angoff, how many of them are really going to get that question right? Stephanie, I'll say it's something that I haven't solved for sure. And it's just an ongoing, issue. I think it helped because we toyed around of like, where should we start with the performance level descriptor? Do we start in the middle and then work our way out, or how do we do it? I think it helped us to truly start at the lowest level and work our way up, because it kind of forced them from the start of like, okay, but what can they do? And start and kind of frame it in that positive way. But I will tell you, it was still a major. We didn't fix it, but it was a little better. Yeah.
Thank you.
Yeah.
I wanted to ask you also if you consider, or if what's your opinion on including item writers as the people who are helping you setting the standard.
Yep. We typically will not. We did have, there's like kind of support staff. We had our editor-in-chief, who's kind of our head item writer, head of all of our item writers and everything. But her role there was really more to help. It was also just say, I can keep going because my next meeting is with Henry. And so we can kind of, so anyone, thank you all for your time. If you need to leave, I won't be offended, but I'm also happy to stick around. We had them there as support staff to help answer questions. If someone had questions, okay, but like, what is the EOC exam? Like, what are you doing with these different pieces? So they could answer that. My opinion has always been, if I want information from our item writers, we can get that anytime, really, so it's like, it's not too much to ask your item writers to go through some kind of standard setting exercise as a part of item writing, things like that. So it's more, part of it's opportunity driven. This is our chance to get outside eyes. I also think, and there is literature that speaks to this, that item writers are just so familiar with the test content that it feels easier to them. They've seen the items so many times that by the time they're making a rating, in their mind, it's already been answered, and so they tend to like rate a little bit higher across the board. So we typically won't, but I think it is good to like have those people around, because again, every standard setting I've ever been a part of, just speaking from experience, there are comments about the items, right? You have to reorient them. Our purpose here is to make these judgments and set this cut score. And they're like, yeah, but like, why'd they say this in this item? And I constantly have to say, thank you. Like I've got that down. I will definitely take that back to the item writers, but let's get back to the discussion at hand. So yeah, it's a double-edged sword there in some ways. I think their input is definitely valuable. But I usually try to get an external folks who are really seeing the content for the first time in the workshop. Henry, go ahead.
Yeah, I wanted to ask, you mentioned that at some point you've had 12 PA in the room, you've had 13. What is the minimum number of subject matter expert that one can have and say this is a well-validated standard settings?
So a lot of the literature will say 12 to 15 is kind of that minimal range that you should be shooting for. I'll tell you that it can be a challenge. I will tell you, especially with smaller exam programs, once you start getting down to something like pediatric nephrology, which is just a smaller subspecialty overall, identifying enough folks who are going to be able to be there for the meeting to do the work, it can be challenging. And so I think you can get as low 8 to 10. I'd say if you get below 8, you're in real trouble. Like at that point, I think at the end of the day, you need to set a cut score, and 8 is better than 1, than 1 expert, anything like that. So it is one of those cases to where it's typically the more the better. I'd say that once you get above 15, it's hard to manage the room. And so I'd say that's when you start to run into some of the other logistical constraints of saying, okay, but like, how are we actually going to facilitate this meeting when we have 18, 20 people in the room? At that point, you usually want to split into tables, have like a table lead, things like that, but it just changes the overall nature of the standard setting. You then also run into like group dynamics to where certain tables might come out a little different than others because the conversations they're having are nested as opposed to the group conversations. I really like to have 12 to 15 people in the room. I think that with that number, you can facilitate the discussion. You can still hear from everyone. You can still split off into small groups. Henry saw some of that in what we did when we did the performance level descriptors. It wasn't a 15-person conversation. It was group of 3 here, group of 3 here, group of 3 there. They all worked through all of them. They all saw all of them, and we discussed them as a group at the end, but they weren't trying to have that full 15-person discussion on cardiovascular diagnosis items, things like that. So I'd say do your best to get 12 to 15. 10 is a nice round number that, people usually don't get too upset about. At the end of the day, you're also going to be the expert on this to your board, right? And so at the end of the day, they are going to listen to you. And what did you do to ensure that you had enough of a sample there, that it was representative, and that the numbers we're getting to at the end represent the thoughts of, you know, a representative sample of panelists. I'd say the representativeness and getting those perspectives in the room is more important than the raw number. But I'd say generally 12 to 15 is where you want to shoot.
Thank you so much. Any other question before, you know,